Welcome to Wasted Water, a podcast where we dive deep into the impacts of wastewater pollution and explore solutions for sustainable sanitation. With 80% of the world's wastewater entering the environment without any treatment, it's time we investigate how this issue is being tackled across disciplines and geographies. Together, we can learn from these approaches and galvanize action in the solution space for the health of people and nature. This podcast is sponsored by the Nature Conservancy's Wastewater Pollution Program, with generous support from Oceankind.
Cholera. It's a waterborne illness that seems anachronistic in today's world of advanced medicine and novel pathogens. But in truth, this 200-year-old disease continues to plague communities worldwide. Since March 2022, over 1,200 people have died in Malawi from cholera, the most deadly outbreak of this disease in the country's history. The outbreak followed 2 large tropical storms that caused flooding, displacement, and a lack of access to safe water, sanitation, and hygiene.
Cyclone Nana happened around January, and then by March, because of a lot of flooding that happened, a lot of sanitation facilities, which are mostly pit latrines, got flooded, some got washed away. So there was a mixture of drinking water getting polluted with fecal matter from the latrines, even from the sewerages. To make matters worse, this cyclone also affected the water supply. So with all the debris, our hydropower couldn't provide electricity. So that also affected the utility companies in terms of providing water. And people were in camps, in crowded places. As a result, cholera breakout happened. Cumulatively, to date, we've had over 58,822 cholera cases. This is unheard of, but this is a true impact of climate change. And with frequent flooding in the past years, it has become really a problem.
You're hearing from Kate Harawa, Malawi Director of Influence and Scale for the nonprofit Water for People. Unfortunately, her experience is not unique. Across the globe, nearly 4 billion people live without safe sanitation. Exposure to contaminated waters allows the spread of waterborne diseases like cholera. In fact, over 800,000 people die each year from unsafe drinking water. But the reach of the global sanitation crisis extends far beyond public health. Ecosystems downstream suffer along with people. So today we ask, why are public health and ecological health protection efforts so siloed? And do collaborative solutions exist? The Nature Conservancy and other environmental organizations are trying to protect water quality from inadequate wastewater management to sustain coral reefs, mangroves, and other important ecological systems. Meanwhile, the WASH sector, which stands for Water, Sanitation, and Hygiene, plays a key role in human health and international development. They're the folks leading the charge to accomplish the UN Sustainable Development Goal number 6, ensuring availability and sustainable management of water and sanitation for all by 2030. We know that globally NGOs, tech companies, and government organizations in the WASH sector are working toward improved sanitation for human benefit, and that conservation practitioners are working to save the aquatic systems being impacted by wastewater pollution. But it seems like building partnerships across these sectors to improve wastewater management in support of both goals hasn't been common practice. Kate, who you heard from earlier, discusses why this may be with her colleague Kelly Latham, Global Advisor for Climate and Water Resource Management.
I see really 3 strong barriers that we're trying to overcome. And one of them is about language. So I think we've all been in a room, whether it's a new job, a new organization, or sitting in a conference that's outside of your comfort zone. So I think there is a real need to not just de-jargon and use fewer acronyms, but really take the time to understand the other concepts. Another common barrier is just simply the time. We need to be able to have time that's not just in that productivity, but really time to learn enough about other sectors to be able to start looking for overlap. And then I think maybe the biggest one or a huge one is we need some common goals and accountability measures that keep us elevated at the right point of that connection. So if we look at wastewater in the conservation space and we look at sanitation in the public health space, they're two very similar things. But in the public health side, our big global goal and ambition is about reducing that gap in service coverage so that people have access to decent toilets that aren't shared with other families. That's the goal. There's no statement about protecting the environment, where on the wastewater conservation side, it's all about treating waste so it doesn't harm the environment. That end target is very different. And so it somehow forces us into other, not just goals, but accountability mechanisms, different investors, different timeframes for programs. Those different goals and accountability mechanisms that drive our sectors are part of the challenge.
And indeed, it's a big challenge. So what are the enabling conditions that drive successful outcomes and collaboration between these two sectors? We spoke with Haleemah Qureshi, Senior Research Manager at the nonprofit Aquaya, to learn more about the Institute's research under the Urban WASH Project, a 5-year endeavor funded by USAID to identify successful enabling environments for urban water access.
It does seem as if without a strong economic motivation for looking at conservation, that has always been a secondary priority to provision of basic services. For most of last year, we were conducting desk-based research, which was essentially a comparative case study analysis of the enabling environment for water and sanitation provision in low resource settings. So we were taking a look at 11 case studies, 6 of which were focused on understanding historical successes in water provision and equitable water provision within low resource cities. And 5 of our cases were focused on understanding contexts or cities that are currently pioneering approaches to improve sanitation in an equitable manner across the city.
Haleemah's team found that water pollution concerns have driven progress in water supply and wastewater treatment in a few areas. In Annabad, India, pollution of the Sabarmati River resulted in the establishment of additional sewage treatment plants. In Bangkok, Thailand, surface water pollution caused by severe flooding prompted the city to adopt new approaches to water supply and treatment. In Porto Alegre, Brazil, blue algae in Guaíba Lake from discharged waste spurred the development of an integrated water cycle vision. This comprehensive approach encompasses the entire sanitation chain, from household sanitation infrastructure to the discharge of effluent wastewater, all with the overarching aim of safeguarding the city's water resources more effectively. The conservation community is often thinking about partnerships with WASH in terms of how to motivate this sector to include consideration of the environment in their work. But how much has the conservation sector been engaging in water resilience?
Especially in the historical cases, we did not come across a lot of examples of the conservation groups or advocacy organizations involved in conservation playing a really large role in promoting inclusive water services. A lot of our cities that we were looking at had encountered at some point in their history environmental crises, and they had to respond to those crises while trying to continue managing and providing water for their residents. So it was almost always as if our case studies, cities were reacting to crises rather than being actively involved in preventing those crises from taking place. Egypt is a bit of a unique case. It is the only one in our 6 case studies which has really thought about water conservation and water management prior to a crisis taking place. And that is because of the context in which they live. The majority of Egypt's population lives within a mile of the Nile River. Areas outside of that are not habitable or not productive, cannot be used for productive uses. So Egypt is very aware and has always been aware of how valuable their water resource is. And so they have, unlike many other places, been taking a lot of steps to try and think of how to manage that.
One of the ways that Egypt has been advancing sustainable water management is by converging conservation and sanitation goals. Their National Water Resources Plan 2037 and National Vision 2030 encompass provisions to protect freshwater sources, advance water purification technology, improve management practices, and increase wastewater reuse. Cairo is already using treated wastewater to irrigate non-food crops and timber, which reduces strain on the Nile River and benefits aquatic systems. We found a common theme emerging in our conversations. When conservation and WASH organizations vocalize support for integrated water and sanitation services, we can support policymaking that prioritizes equitable access and inclusive services for disadvantaged communities.
It is difficult to reach lower income populations without designing specific policies that are meant to reach lower income populations. And so one of our cases in Abidjan in Côte d'Ivoire, the Ivory Coast in West Africa, they historically are known actually for the progress that they made in inclusive water services when they introduced these connection subsidies. They designed subsidies that reduced the barrier for low-income households to connect to the piped network. And that is what actually allowed folks who were living in low-income settlements and didn't have access to water to finally connect to the network at a lower cost than what it would have been for everybody else. And it allowed the city to expand its services into these lower-income areas. A lot of cities did also, although conservation did not necessarily play a preventative role in many places, that in some cases, when people were confronted with environmental crises, they did respond in a way that improved the overall condition.
Haleemah reflects back on another great example of an equitable whole systems approach to improving water and sanitation services.
In Ahmedabad, what we see historically is that the local government chose a kind of integrated slum upgradation program. It's kind of seen and cited to this day as a success story, but essentially informal settlements within the city were upgraded. And so multiple services and service needs were addressed at the same time. And so households were not only given access to piped water networks, but there was, they paid attention to road networks and how the roads were laid, which actually made it easier to connect households to pipes and infrastructure. So it was road upgradation, drainage, lighting, a lot of different services that were kind of upgraded at the same time in order to address the physical barriers, the contextual barriers of providing services to lower income households in informal settlements.
In her research on innovative pioneering cities, Haleemah found that certain conditions enabled both inclusive sanitation and water provision approaches.
We found that there are a lot of similar characteristics or factors that can improve inclusive sanitation, similar to factors that improve inclusive water provision. And those are, like I mentioned previously, having specific pro-poor policies, for example, or looking at their provision holistically. I think that in low resource settings, specifically these days, we have a greater movement towards managing waste, managing specifically, we call it fecal sludge management, FSM services, or you can now you'll hear citywide inclusive sanitation or CWIS. These are all the new words that are being used to basically include those who are not connected to piped sewerage services. Considering, yes, although we are trying to increase and improve piped sewerage in many places, the rate at which urbanization is taking place and the rate at which people are not connected to sewerage, it is incumbent on us to consider non-piped sanitation approaches as well. And in all of our cases, all of our cities, they were either taking regulatory approaches. So suddenly the local government is not just responsible for water and wastewater, they are also now responsible for sanitation.
And what about situations where financial support may not yet be established? A common question from conservation practitioners is, how do we finance this type of work? Kelly and Kate discuss sustainable financing mechanisms, which they've found effective.
Great. That's a really great question. And I think the first step is to understand the financial landscape of an area so you can see how to improve and complement what is already happening in terms of financial flows. So let's look at the financing landscape for sanitation services in Africa, where we are fortunate to have an investment action plan that was developed by the African Investment Program. And this action plan shows us that the annual investment needs for water and sanitation in Africa is $30 billion US dollars. So 30 billion USD per year. 30 billion might sound like a lot, but this action plan shows us that the amount of money is not actually the challenge. Of the 30 billion, it's easy to find over half that can come from domestic resource mobilization. So that's through country budgets, institutional investors in country, pollution and mineral resource taxes, and banks. The next biggest source, around 10 billion, is from savings and averted costs. Savings that were identified from efficiencies from better governance and averted costs from improved water stewardship. The smallest amount, less than 5 billion, can come from bilateral organizations, multilateral organizations, climate funds, and philanthropies like ours. So again, the challenge is not in the total amount and where it could come from. It's in how that money can flow in the right direction without blockages and with efficiency. So I think the real question here is how can the conservation sector help increase that flow more efficiently in Africa? And based on our experience and the bottlenecks identified in the action plan, 3 clear opportunities emerge. The first is to help the water and sanitation sector understand the cost of water stewardship, the need to value water-related risks and observe environmental standards. By doing this, we can unlock significant savings. The second is to lead or collaborate with multi-sector efforts to address water security through sustainable sanitation. On the finance side, there's already big multi-sector thinking on how to finance, but on the implementer side, there's not clear platforms for accessing those multi-sector funds. We all like to still sit and work within our same sector. And so we really have to figure out how to work across sector with cross-sector accountability measures. And then lastly, the conservation sector can invest in the existing sanitation development actors who already have expertise and know how to increase sanitation services sustainably in an area and in line with the national sector investment plan. And those national sector investment plans, which exist and are becoming more common across Africa as part of this regional effort, is something that actually Kate can share more on with her experience in Malawi.
Yeah, that's right, Kelly. From last year, we got engaged, I think 2021, 2022, engaged in supporting the Ministry of Water and Sanitation to develop a climate-resilient water finance strategy together with other colleagues. IRC and UNICEF was supporting the process. And after we had developed the climate resilient water finance strategy, which also opened up a lot of discussion with different institutions, the World Bank, other development partners, as well as in terms of the ministry, not just Ministry of Water, but Ministry of Finance, Ministry of Forestry and Natural Resources, Ministry of Health, Ministry of Agriculture. So all these people were engaged, including NGOs. And it received so much acceptance and buy-in from government and development partners. So after it was launched, a World Bank came into the ministry to say, we would like to support for you to roll out some of the strategies.
In researching the case studies on water provision, Haleemah and her team found that the significant capital expenses needed for infrastructure expansion, especially in low-resource regions, were mostly paid by international donors and governments. In one city, however, the government uses a variety of mechanisms to leverage municipal funds.
In Ahmedabad, essentially the structure is that people are not paying water and wastewater bills, but they are paying property taxes. And so a portion of that is being earmarked for infrastructure, which is interesting and different to what you see in a lot of other places, which is just kind of bills that are being used to try and recover some costs, the local government is required by legislation to spend, I believe it's 10% of their local revenue or budget on services to low-income areas. So that pot of money, it gets divided there. Like they have to spend that for low-income service provision, which is very progressive and very equitable. In terms of funding capital expenses, Ahmedabad has also been looking into municipal bonds.
And if you're wondering what those are, municipal bonds are low-risk investments that act as loans for government entities, so they can fund public projects like capital infrastructure. Now back to Haleemah.
It's how a lot of infrastructure in the U.S. gets funded. That's something that we found very interesting to see taking place in Ahmedabad, and I think it is curious and something that would be interesting to look further into is the applicability and viability of that kind of mechanism or structure to fund similar needs in other places.
We've explored the enabling conditions and avenues for financing options. But what about the solutions themselves? One solution that draws a diversity of stakeholders from across sectors and finances a holistic approach to these issues are water funds, a model also known as watershed investment programs or catchment conservation. The water fund model has had great success across the globe in its ability to address water security, disaster resilience, and economic stability. We spoke with Maria Cristina de la Paz to learn more. She's coordinator of the Resilient Watershed Program for the Nature Conservancy's Ecuador chapter and is working to ensure water security through integrative watershed management.
Water funds are multi-stakeholder partnerships that bring together key water users that are from the public sector or from the private sectors. And the purpose of this platform or this institution is to jointly invest in the conservation of water sources in a given area. So this main idea was first thought through TNC and other institutions back in 1999. And in 2000, we helped to establish the first water fund, which was the Quito Water Fund. And now it has 23 years of life. And we can really say that it has been a model for the world.
In Ecuador, hydric stress has worsened from the area's extreme seasons of rainfall and drought, which is aggravated further by climate change. The Nature Conservancy and partners found the region's water management practices to be unsustainable, given water scarcity in some urban areas, plus the lack of wastewater treatment and impact on local freshwater resources. An important piece of the puzzle in protecting watershed security is ensuring good water quality, which requires effective wastewater management.
There's a really big threat of how wastewater pollution is impacting water security on Ecuador, on the region, and of course, in the global scale. We only have 2 cities in Ecuador that are treating wastewater. But for instance, the capital, which is Quito, we're not doing anything. So every time we flush our toilets, it's going directly to our main rivers. But the problem is that it's kind of invisible because once we flush our toilets or use any of the water that we're using every day, it disappears. We don't see what's going on afterwards. Everything that is going on the terrestrial or in the continent is ultimately affecting the ocean, especially if we're talking about wastewater. Because all that water that is not being treated, all of that soil erosion and waste and pollution is going direct to the ocean. We are trying to incorporate wastewater pollution mitigation through water funds and through water protection areas.
The model was also adopted in Malawi. Kate and Kelly explain how their work through Water for People ended up as a water fund in collaboration with the Nature Conservancy.
The concept of water funds is an interesting one where you work with both the upstream and the downstream users. So you engage the downstream users to be able to pay for ecosystems upstream. and allow the people in the upstream to manage the catchments in a way that they are both benefiting. So it sets up a governance structure that is more sustainable and that works and coordinates all these activities based on science. With the water fund model, I've learned a lot in terms of how to engage other people, not just the water supply people, water and sanitation people, the wash people, but even the forestry people, the environmental people. We realize that if we continue doing things the usual way, just as water for people, then we will not be able to reach out to others. We cannot achieve sustainability just on our own. We need other people, we need other players.
After learning about the water fund model, we wondered, how does one get started with replicating this concept? Kelly reflects back on how Water for People and the Nature Conservancy first began to work together.
We realized that we had some very similar organizational philosophies in committing to models that are results-based and bringing people and investors along the way of that result and outcome you're aiming for versus working only in kind of time-bound programs. That shared philosophy and believing that the work is finished when the result is actually achieved versus the work is finished when a deadline is hit. So that shared philosophy, I think, was another key factor in just these initial conversations. And then I think this recognition on both sides, the expertise needed to really address the challenge didn't sit within either one of our organizations. And the option to staff up your own organization to meet the challenge or collaborate with those who already have the expertise, it's much more appealing to collaborate.
Maria Cristina is currently working on scaling wastewater treatment through the Water Funds framework. However, achieving this goal requires input and coordination from more than just one organization. In Ecuador, to bring in stakeholders from across sectors, the National Roundtable of Sanitation, Wastewater Treatment, and Climate Change was convened in 2019. A crucial partner in all of this was UNICEF. Maria Cristina explains how discovering common goals with the humanitarian aid organization has led to successful collaboration and development of a long-term ally to the conservation sector's efforts.
I can go back to why someone like UNICEF, which works in the health sector, which is completely different of what we're doing, right? They're trying to save children. And when we talked to them, we said, hey, we have this proposal. We want to start treating water. We just wanted to see if they could help us measure some of the effects on the health of the people. But they actually have a wash strategy in UNICEF. This is a big deal. We decided that we did not want to stop there. We said we had to do something about it. How about we do a table where we can bring together institutions, we can promote and discuss with key actors to promote a dialogue of effective collaboration.
The National Roundtable was an absolute success. It resulted in 4 workshops, where together they developed a document with 60 strategic recommendations for sanitation, wastewater treatment, and climate change. In the process, they aggregated relevant resources, documents, and best practices into a knowledge platform and presented their strategy recommendations to the government.
Now we're talking with 2 sectors completely different, but we are seeing that the root of the problem is the same, which is we're not treating our water properly and we're all getting sick. We're losing biodiversity. Children are having diarrheal problems. And children are not being able to go to school, for instance. The burden on women is even higher now because the children are getting sicker, so everything, it's a chain reaction. This is a common issue that we're trying to tackle, as you say, in 2 different ways, separately. But it's something that I think that we have to try to change. All of these problems are interconnected. So the solutions should be interconnected as well.
We have a challenging task ahead, addressing a complex, cross-cutting issue that demands extensive discussions across various sectors. But throughout these interviews, a common sentiment was tangible: hope. Hope in knowing there are motivated collaborators out there who are ready to take on the challenge of water security and sustainable wastewater management together.
It's been a journey to know that in working together, we are not competing, but we are actually complementing each other to reach our goals. The routes may be different. We may frame our goals differently, but really, when we work together, we will both achieve our goals. We can do better in working together than working in silos.
We have to all remember that we are not protecting nature from people, we are protecting nature for people. And it's such a simple phrase and change. It's literally dropping the M from, and it almost sounds like the same thing, but it is so fundamentally different. There is an absolute connection that humans are one of the species in the ecosystem that have a better chance of surviving when we do that. And so focusing on protecting nature for people, I think, is where both sectors can come together and recognize that we will both benefit if we both work together towards that same goal.
Thank you for listening to this episode of the Wasted Water Podcast. If you'd like to be a part of the solution to wastewater pollution, we encourage you to learn more about the environmental impacts of wastewater pollution by visiting the Ocean Sewage Alliance Knowledge Hub and the Reef Resilience Network's Wastewater Pollution free online course and webinar series. And don't forget to check out the incredible work of our interviewees. Links to their projects and other resources cited during the episode can be found in the show notes. We also invite you to subscribe and share your questions and comments with us on our social, @WastedWaterPod. Until next time, let's continue to explore innovative solutions to addressing wastewater management to protect people and nature.
This episode was made possible by our listeners, Water for People, Aquaya, USAID, and the Nature Conservancy through generous support from Oceankind.